Hi, I'm Michelle Thompson, and I am the Director for the Executive Coaching and Consultation Program here in the Townsend Institute at Concordia University.
Hi, I'm Dr. Donna Washburn, and I'm the Director of the Counseling Program here at the Townsend Institute at Concordia University.
Donna and I are really excited to spend a few minutes with you today because we get the question, what is the difference between counseling and coaching? And you might be asking yourself that same question too. So Donna, let's just share a few ideas about the differences that we see about the students that we're looking for, as well as where these careers take them. How's that sound to you?
That sounds great. I'd love to do that.
Good. So tell me a little bit, Donna, about what's counseling like for you. What does that counseling student that comes in look like?
Yeah, so it's a really good question, and we do have students that come and ask us, should I be a counselor or should I go and be a coach? And you know, to me, I start asking two basic questions. First of all, do you want to become a licensed professional counselor in your home state? We are a professional training program that walks students through their academic journey towards becoming licensed as a counselor in their state. So that's one of the first basic questions I ask. But the next question is a little bit more nuanced and a little deeper. Do they want to help individuals who are really hurting and help them move towards healing? Do they want to work with people who have had trauma, who've had addictions, who have deep mental health concerns? Do they want to get in the well with individuals who are broken and who are really making life and death determinations in their life? That's what counselors do every single day.
I love that definition, and there's a metaphor that I use with counseling and coaching, because coaching, like counseling is the healing, coaching is the development part. How do we make that success moving on? So the metaphor that I have been using is counseling is like being the surgeon. The surgeon goes into the operating room, cuts a person open, finds what's wrong, does the healing, does the fixing so that the person can be whole physically again. And then in coaching is a little bit like that physical therapy or even personal trainer point of view, where it's important for us as coaches to know that you had the knee replacement maybe, but we're not healing the knee replacement. We're taking that knowledge and that information and moving forward so that those people can reach their goals and their dreams, or just to be able to move beyond whatever is blocking them in life towards success.
Yeah, I really love that metaphor. I think that is really spot on, that, you know, counselors, we dig deep. We are every single day in the pit, sometimes we say, with our clients, and unpacking a lot of pain, a lot of trauma, a lot of things from the past. And we do want to help them move forward, of course. But I talk to the prospective students and say, you know, are you wanting to work with people who have intense anxiety, who may have significant depression, who may have even some psychotic tendencies? That's what counselors wrestle with every day with their clients. I would assume in coaching world, people come to them already with a measure of health, and then they move them forward.
That's exactly right. In fact, in coaching, we assume that there's a measure of health, and even if, as we are coaching someone, and we recognize that there might be a deep trauma or something that needs more work, as coaches, we partner with the counselor and say, counselor, we need you to work with this person to help do the healing so that we can continue to do the developing along the way.
Really appreciate that. So that mental health component, that's what we're focusing on, and you're focusing on moving forward, taking already health and making it even better, perhaps. So we can partner together with coaches and counselors, but they are definitely two distinct professions.
Absolutely. You say profession, so if we have students coming in here, they're hoping to have a career and move forward. Tell me a little bit about, what does a career in counseling look like?
That's an excellent question. So the nice thing is counseling is pretty broad, but what is the center point is clinical mental health. So we have counselors that work in substance abuse treatment recovery centers. We have counselors that work in community mental health centers. We have counselors that work in churches, but they do deep mental health counseling with parishioners, and that is different even than pastoral counseling. We have counselors that can go work with individuals who are dealing with trauma, domestic violence, child abuse, pretty much any social problem you think of. There are counselors there working on the mental health needs of those people.
That's fabulous. And again, I want to stress that you keep talking about those locations as places where people receive the healing piece. Because just like there's the variation in the counseling. There's variations in coaching. Once you know the coaching skills, you can coach in so many arenas. You can coach in executive leaders, you can do some life coaching, you can do recovery coaching, you can work internally within an organization or externally. There's tons of options out there. And with coaching, while we don't have licensure, we do have some credentialing, and we're working together with the International Coaching Federation to put that credentialing in place that just gives that golden standard of, hey, these are coaches that know the skill of coaching really super well.
You know, I'm glad you brought up credentialing. So prospective students probably look at lots of different counseling programs out there, and the one thing that should be consistent is the accreditation that goes along with a counseling program. And a prospective student wants to look for the accreditation that's called CACREP. And Townsend Institute has that gold standard of accreditation for counseling, which is the CACREP accreditation. And what that means is our students can be guaranteed to meet all the state standards to sit for licensure one day. It does mean we have a 60-hour credit program for them to come through, which I think that's different than the number of credits that our coaching students do.
Absolutely. Donna, it is so great to talk about these things, and I think the thing that really sticks out to me is that both of these careers and opportunities create space for people. And that space either is a space that will bring healing or work on development. Both are great options. We would really look forward to the opportunity to work with you and have you here at the Townsend Institute. Contact us and let us know how we can help.